Okay, Darla, we've discussed, I know you've told me what your complaint is. Could you tell our viewers what brought you in, what you've been through?
Sure. I just have a really bad pain in my low back, and it just doesn't go away, and it's starting to go down the back of my legs. I've been to my medical doctor. I've tried, pain relief, pain pills. It's not helping. I've tried hot tubs. I feel like I've tried everything. I'm ready for some pain relief, for something different.
Okay. Well, we've done a physical examination, and based on those results, we'd like to shoot a couple x-rays, but I really need to ask you a couple of important questions first. Number one, is there any chance you're pregnant?
No, not at all.
Okay. Have you had any x-rays recently of your low back?
No, not in a long time.
Okay. Then we're going to proceed now and around the corner and shoot a couple x-rays.
Okay.
Okay. Well, Darla, we've completed your x-rays, and we discovered something. We discovered a problem at the lowest segment in your low back, the L5 lumbar vertebra. What we're going to do now is start off with some treatment. What I'd like to have you do is lie face down on this table. Your head is at this end, and we'll get started. You can lay your arms on the side there.
Okay.
Okay, now you're going to feel the piece underneath your belly dropping down a little bit. Is that comfortable?
Yeah.
Okay. During the exam, we found a couple tight areas in Darla's upper back. We're going to adjust those. Let me show you how that takes place. I'm going to apply a little bit of pressure straight down. There's a little clicking noise. I don't think you could hear it, but I'm sure Darla could, and we can feel it here. One more. Okay.
Do your patients experience any pain when you go through these adjustments?
Rarely do they. Usually there's an immediate sense of some relief. Occasionally there's not a relief right away, though, but it is a very comfortable technique. Now we're going to move down to Darla's lower back and treat the problem area. With the help of this table, it's called a flexion distraction table, I'm going to turn this table on. We're going to be able to stretch Darla's low back in a very specific way. In this case, I use my hands in this way to open up the area of Darla's low back that is causing pressure on the nerve roots.
Ordinarily, how long would a treatment like this take?
Normally it would take anywhere from 10 to 20 minutes. We will do a series of repetitions and maybe apply an ice pack or ultrasound and then go back and do another set of repetitions. That will continue on for about 10 to 20 minutes.
Would she expect to feel some relief immediately, or would she have to...
Normally she would experience a certain amount of relief immediately.
And then when would she come back for her next treatment?
In Darla's case, she'd probably come back in about 2 days, and we'd repeat the same procedure. This whole treatment program might last 2 weeks for this type of a condition.
So that would be an average for some relief, and then
for this type of problem, that's correct.
Then you'd give it some time and see what would happen? And
then we set her on her way, have her return to her normal activities, albeit corrected activities, so she's not re-injuring her back, and see how she does.
What actually allows that vertebrae to try to go back to its normal alignment? Are you allowing muscles to be relaxing and things to sort of slip back?
Yeah, several things happen. We relax the muscles with this procedure or with the moist heat or ultrasound, other modalities we use. Then we restore normal joint motion. If it's locked up, it's no longer locked up. When we do the procedure where we stretch the low back, we pull apart the two vertebrae a little bit. That allows the disc to actually move back into place.
Well, this is interesting. If a patient, though, let's say, had a neck or a tension headache problem, would it be a similar type of treatment? Obviously not working down here, but working higher up?
It would be very similar. Most tension headaches we find resolve very easily with a neck adjustment. The frequent cause that we find is that the vertebrae in the neck become locked up or fixated to each other, and that creates some reflex muscle spasms into the scalp. By restoring the normal joint motion in the neck, the source of the irritation is gone. The headache usually subsides almost immediately.
Headache is such a complicated area in medicine, and there's so many different possible causes. So your history is probably very detailed.
Oh, sure. The history is vital. As we were trained, your diagnosis comes from your history primarily. The physical exam is to help determine for sure.
And you might even deal with other medical doctors in that headache evaluation to be sure you're not getting some other area that could be going on. Very good. Why don't we have her sit up and see if she's handled the treatment all right today. Well, you're still in one piece?
Yeah, it feels okay.
Great. Do you actually feel something, a little release of some of that tension?
It feels more relaxed, feels better already.
Great.
It does.
Well, I want to thank you both for appearing on our Medical Explorer program today. Dr. Perillo, it's been a true pleasure. Now, if patients wanted to come and see you, can they just come in directly, make their own appointment?
Sure. We prefer that they call ahead, and we can make an appointment, usually on the same day.
What number would they call if they wanted to see you?
They call 671-4976.
671-4976. Right in Yuba City at Queens and Live Oak Boulevard.
Yeah, we're in the North Point Shopping Center.
Great. Well, thanks again. It's been a pleasure, and I've learned a lot today, and I know our viewers have too. Thank you. Again, I would like to thank Dr. Perillo for taking time out of his busy schedule and allowing the Medical Explorer to travel behind the scenes of his office practice. There's no question that there is a demand for chiropractic care in our communities. Medical doctors, unfortunately, do not always have suggestions and resources available to treat patients with the annoying back and neck problems. The chiropractor offers a licensed alternative for patients with this type of disorder, and many chiropractors, like Dr. Perillo, have proven their success in treating back and neck problems. However, I must caution my viewers about seeking chiropractic care for the treatment of organic medical disorders like heart diseases, allergies, diabetes, skin problems, and stomach problems. There is no physiological way, I repeat, there is no physiological way that spinal manipulations could prevent a heart attack or stop the spread of cancer. And there's no logical way that this type of treatment could help psoriasis, allergies, or breathing disorders any more than a sugar pill will help treat high blood pressure or a brain tumor. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas and people that you'd like to see on this program. I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. We are a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me here at the Skin and Allergy Medical Group of Yuba City at 350 Del Norte Avenue, Yuba City, California, 95991. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City, Marysville, and Stockton areas. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.